Hello everyone, here is Dr. Guo Hongzhang from Department of Pathology, Sino University Medical College. Last lecture, we have discussed the definition and molecular features of tumors. And now, you know some hallmarks of tumor, such as sustained proliferative signaling and the evasion of growth suppressors. Today, we are going to talk about how tumor can spread to distant organs from their size of orange. I will introduce the dose, tumor cellular behavior from these aspects, biological of tumor growth, the growth pattern, and the spread. First, let's go to know the biology of tumor growth. Generally, tumor cell is a cell that grows out of control. Some factors influence this process, including the kinetics of the tumor cell growth, angiogenesis, and the tumor progression. Specifically, the kinetics is based on the measurement of the tumor doubling times, which means that the time it takes for a cell to duplicate itself. Like this here, the time spent on the division of a mother cell into two dog cells. The growth fraction of tumor cell means the percentage of cells within the tumor that are growing. The cell number of tumor is increased by cell division, while it's decreased either through apoptosis or necrosis. Surprisingly, the total cell cycle time for many tumors is equal to or even longer than that of corresponding normal cells. Tumors are thought to grow rapidly due to imbalance between cell division and cell loss. The kinetics of tumor cell growth can be translated into clinical tumor therapy, such as chemotherapy, which is a drug treatment that uses powerful chemical to kill fast-growing tumor cells. Besides cell division, tumor cell growth also need an appropriate microenvironment, especially nutrients from blood. So, tumor cell had the capacity of constructing this microenvironment by including blood vessel formation, which we called angiogenesis. Actually, tumor induced the growth of new vessel, which developed following stimulation of endothelial cells with existing vascular networks near the tumor, providing an independent blood supply for this tumor. Therefore, tumor angiogenesis is similar to wound healing. Tumor cells release a lot of cytokines to stimulate blood vessel proliferation, such as VEGF, which exerts its effects on vascular endothelial cells, promoting the formation of new blood vessels. Angiogenesis is essentially for tumor growth and is controlled by the balance between angiogenic factors produced by tumor and stromal cells. Hypoxia triggers angiogenesis through the action of HIF-1 alpha on the transcription of the pro-angiogenic factor VEGF. During its growth, the tumor becomes more aggressive and acquired great malignant potential over time. We call this ability tumor progression. Tumor heterogeneity describes the phenomenon that different tumor cells can show distinct morphological and phenotypical profiles, including cellular morphology, mutability, proliferation, and metastatic potential. Therefore, the tumor bulk might include a divided subgroup of cells having distinct molecular signature with different level of sensitivity to treatment. Tumor heterogeneity provides the funnel for drug resistance. Tumor growth can display different visible patterns. First one is the expansile growth pattern, which is defined by expansion but with a well-circumscribed tumor border. Here, multiple mass in the uterus has discrete border between normal and tumor tissue. So, the growth pattern usually indicates a benign tumor. Exophatic growth pattern can happen in benign and malignant tumors. We can see on this slide, the exophatic tumor grows in out from the surface. The right one is a malignant tumor with cauliflower-like cluster, while the left one is a benign tumor with a polyp. Invasion growth pattern involves progressive infiltrating, invasion, and destruction of the surrounding tissue. Tumors with this growth pattern are poorly defined and non-encapsulated. Here we have the cut section of invasive ductal carcinoma of the breast. The lesion is retracted, infiltrating the surrounding breast substance, and was stony hard on palpation. Tumor spread means the tumor migrates from its point of origin to other sites, and is characteristic of malignant tumors. Clinically, this is manifested by local invasion and distant metastasis. The proliferation tumor cells and the progressive increase in tumor size eventually even lead to a breach in the barrier between tissues, leading to tumor extension into adjacent tissue. When tumor cell becomes mortal, it begins to invade tissue nearby the primary tumor. This process, known as local invasion. In other words, local invasion is the direct extension and penetration by cancer cell into neighbor tissue. Local invasion is also the first stage in the process that leads to the development of secondary tumor or metastasis. Microscopic view of the breast carcinoma illustrates the invasion of breast stroma and fat by nests and cause of tumor cells. Note the absence of well-defined capsule. Metastasis in Greek means removal or migration, dislocation, but also departing from life. Here, tumor metastasis is defined as the development of secondary tumor implants, discontinuous with the primary tumor within the host body. Lymphogenous metastasis describe the ability of tumor cell to penetrate into lymphatic vessels. A sentinel lymph node is the first regional lymph node that receives lymph flow from a primary tumor. This site shows carcinoma of the breast, usually arising in the out quadrant and first spread to the accessory nodes. Hematogenous metastasis is a complex process. Cancer cells detached from the primary site invade the vascular by degeneration of the surrounding tissue, migrate to the secondary organ, where the cells attach to and transmigrate through the endothelial cell layer, then invade and grows to form the metastatic tumor. With venous invasion, the blood-borne cell follow the venous flow, draining the site of the neoplasia, with tumor cell often stopping in the first capillary bed they encounter. Since all portal area drainage flows to the liver and all cave blood returns to the lungs, The liver and the lung are the most frequently involved secondary sites in hematogenous dissemination. In this gross specimen, we can identify the solitary nodules of colorectal carcinoma metastatic to the lung. Lymphatic metastasis is more typical of carcinoma, whereas hematogenous spread is followed by sarcoma. Micrometastasis is a small collection of cancer cells sheared from the orange tumor and spread to another part of the body through the lymphovascular system. Spread by seeding means the spread of tumor cells enable tissue. Spread by seeding occurs when malignant tumor invade a natural body cavity. This model of dissemination is particularly characteristic of cancer of the ovary, which often cover the peritoneal surface widely. Metastatic tumor cells, besides reproducing uncontrollably, lost cohesiveness, get detached from the primal tumor and set up colonies. To summarize, in this session, we have discussed how tumor cells grow and spread in the hot body. Tumor progression required sequential steps involving proper coordination of cell growth and angiogenesis. Important steps during tumor progression are tumor growth and subsequent invasion and metastasis. They are the reference, and thank you for your attention.